Cool. So my name's Sabine. I'm a second year paramedic student. I'm just doing a cardiovascular exam on our patient here. So, hi there. What's your name?
Oh, Emma Ballard.
Hi, Emma Ballard. My name's Sabine. I'm going to be doing a cardiovascular exam on you. So that's going to involve me, listening to your chest, poking and prodding your fingers a little bit. Is that okay with you?
Yeah.
Wonderful.
That's fine.
So we're going to be asking our patient if there's any pain. Got any pain anywhere at all? Cold. And our patient isn't obviously short of breath, so she's not particularly cynosed. Her breathing is pretty normal. Rest break's not excessive. And what we're going to be doing is checking the patient's sort of bedside area, just like generally observing the patient. So seeing if she's got, lots of pillows around her bed, any sort of medications, sort of like supplement oxygen or anything like that. Cool. Okay, so I'm just going to be observing your neck. If you could just look at the window for me. So I'm just going to be checking for any obvious increases in jugular venous pressure. And what I'm going to be doing is pushing on the liver. So, sorry. Yep. Just observing for any increases in that pressure. So if we do have any increase in pressure, that could indicate an inferior vena cava obstruction, cardiac tamponade, tricuspid regurgitation, or constrictive pericarditis. Okay, Emma, if I could get you to put your hands out straight in front of you like that. So we're just going to be observing the fingers to see if we've got any splinter hemorrhages, so that could indicate infective endocarditis. And if you just want to pop your fingers together like so. So we've got a little window here, so that's showing that she doesn't have nail clubbing. If there was nail clubbing, we'd be looking at things like congenital cyanotic heart disease. And if your hands out again, so we'll just be looking for Janeway lesions or ulsonal nodes, which could indicate bacterial endocarditis. And just doing a wee cap refill. So that's less than 2 seconds, so that's perfectly fine. And our patient isn't sweaty or clammy. Okay, so now we're going to be observing Emma to see if she's got any cyanosis anywhere in her body. So she hasn't got any in her hands, nothing around the lips at all. And if you just want to pop your eyelid down like that for me. So we haven't got any discoloration, which could indicate sort of anemia. And now we're going to be observing to see if she's got any edema anywhere. So we're going to be exposing her legs. So it doesn't appear to be any edema there. And if you just want to sit forward for me, just going to feel your sacrum. So there doesn't appear to be any edema there. If we did find some, it would be indicative of congestive heart failure. Okay, Emma, if it's alright with you, I'll get you to just take your top off just to expose your chest. So right now we're going to be looking for any sort of obvious signs of scarring or deformity. So you could have things like pectus excavatum or carinatum, so that's like pigeon chest or sort of concave chest. And then what we're going to be doing is also palpating the chest. So if you just want to take a nice deep breath for me. Wonderful. So we haven't got any thrills or any heaves, which can indicate ventricular hypertrophy. Cool. Okay, Emma, now I'm just going to be assessing your abdomen to see if we've got any enlargement of your spleen or your liver. So take a little feel if that's okay. Just some spleen there. So we haven't got any enlargement, so that's perfectly normal. If we did, that would indicate congestive heart failure or infective endocarditis. We're also just going to have a wee feel of the aorta. So we've got a good pulse there, nice and strong, so that's perfectly healthy. Okay, Emma, so what I'm going to be doing now is just assessing your radial pulse, the wee feel of your wrist. So here we're looking for rate, regularity and strength. So she's got a very regular pulse, and we'll just sort of time for about 15 seconds to get a rate. And while we're doing that, we can also assess good strength, so it's pretty equal. So it's roughly about 70. So what we're also going to be doing is assessing the other arm. So I'm going to take both radials. So we're checking that they're equal, which they are. And then what I'm going to get you to do is just lift up your arm. So we haven't got loss of pulse, which is wonderful. Now I'm just going to take a quick blood pressure. And so here we're going to be looking for a blood pressure that's roughly around 120 systolic. So that's normal for someone of Emma's age and size. roughly 130 on 70, which is perfectly healthy. Cool, and after that we're going to be assessing your carotid pulse. So if you just want to face the window again. Cool, and face towards me. Wonderful. Again, so those are regular and they're regular strength, and the rates are the same throughout the body. Okay, Emma, so I'm just going to have another quick listen to your heart. So we're going to be looking for any murmurs or any ectopic beats. So starting with that aortic site. And then we're going to move to the pulmonary site. And then our tricuspid. Sorry, Emma. And our mitral. Wonderful, so that all sounds normal. Alrighty Emma, so I'm just going to listen to the base of your lungs to see if I can hear any fluid. If I did hear fluid, so that would be indicative of pulmonary edema, which could indicate something like congestive heart failure. Alrighty, so that all sounds clear. Okay, so now we're going to be assessing for any crepitus in the chest. I'm just going to put my hands either side of your chest. Take a nice deep breath. Wonderful. So we haven't got any sort of grinding going on there. Some other procedures that we could be doing, we could be taking a 12 lead, doing some blood tests, obviously in hospital, taking an echocardiogram or doing an angiogram. Cool, so that concludes our assessment. Thank you, Emma. You can get dressed again. Thank you.
You can get dressed again.